Is it safe to eat rice that's been left out too long? How much alcohol consumption is too much? I'm Christine Pei, reporter for King 5's Healthlink. Each week I break down the top health headlines and latest medical breakthroughs to keep you informed. Today we're sharing what you need to know about stories that you may have seen trending online. From forever chemicals to fentanyl exposure, here's what you need to know to keep yourself and your family safe. Let's start with what PFAS are exactly. Short for polyfluoroalkyl substances, they are a set of synthetic chemicals found in certain stain and water-resistant products, nonstick cookware, and food packaging, also a type of firefighting foam that is now banned in Washington. It can even be present in tap water.
We are finding elevated levels in multiple areas, especially those close to industry, firefighting operations, airports.
Dr. Bonnie Ronish is the clinic director of occupational and environmental medicine at UW-Med. She says PFAS take a long time to leave your body if they're consumed, but they're not forever.
We do know that your body will take care of it on its own over time. So we know that PFAS actually decreases in the bloodstream as time goes on.
Exactly how much time is unknown, and it's still a health concern. What are some of the more telltale signs that your health might be affected by it?
So the answer is there really isn't. There's nothing that I can point to that says you have PFAS exposure.
But there are links. Dr. Ronish says PFAS can possibly increase the risk for certain conditions like higher cholesterol levels, a decreased response to vaccines among children, high blood pressure among pregnant women, testicular and kidney cancer, and thyroid disease.
You can tell that all of these things are very common in the general population. So it's very difficult to say PFAS caused this, but we know that there's an increased risk beyond what we would expect in a general population.
Further complicating things, the CDC says the body gets rid of PFAS naturally, mostly through urination over time, but it cannot be directly removed.
We can't take it out of the body. We can't chelate it. We can't get you to pee it out. We can't do anything about it, right? All we can do is reduce the exposure.
So that leaves us with prevention. The State Department of Ecology monitors PFAS contamination in drinking water wells. Ronish says be aware of which areas might have higher PFAS levels and pay attention to the products you use.
We want to fix it. We want to change it. We want to help people avoid it. But this is not something that should be causing panic.
There is a blood test to detect PFAS levels in the body, but the CDC says even that can be limiting, as it will be unclear if the results are definitively linked to possible health effects. For more resources on all this, look for this story in the Healthlink section of king5.com.
It's caused by a bacteria called Bacillus cereus.
The bacteria is present all over our environment, notably in the soil, and if left to their own devices, it can grow in our food.
Different foods tend to grow different organisms better than others.
Dr. Christopher Damon is a clinical associate professor of gastroenterology at UW-Medicine.
These organisms will find a way to get a good meal, which is essentially what they're after.
And that good meal can be found in starchy foods like rice, pasta, or potato salad. When it's left out for too long, any Bacillus cereus present in the food can grow and emit toxins that can make us sick.
Your gut isn't reacting to the organism per se, it's reacting to the toxin that organism has already made within the food.
People can get really sick from it.
Daisy Wan is a registered dietitian at Overlake Medical Center. She says don't be fooled if you think food left out smells and looks fine.
I think that can fool people that the food looks okay, it doesn't smell off colorish, but those bacteria are still there.
Food poisoning symptoms from Bacillus cereus can include vomiting, nausea, diarrhea, and low-grade fever.
Food poisoning resolves itself within 24 to 48 hours, but if it's going on more than that, you should definitely seek medical help.
Juan says you should put rice and pasta in the fridge within 2 hours after they're cooked. And another important note, because the toxin from the bacteria is heat resistant, microwaving that old rice or mac and cheese that's been left out for a while won't fix it.
Even if those foods are reheated and heated to a high temperature, that toxin is not removed.
Another reminder, do not eat leftovers from the fridge after more than 3 to 5 days, even if it has been properly cooked. Beyond that, you should throw it out. They are the symptoms that make a hangover miserable.
Headache to dizziness, nausea, fatigue, sensitivity to light, sensitivity to sound.
Dr. Joshua Liao is an internal medicine doctor at UW-Medicine. He says there can be multiple hangover symptoms all at once, so there's not a single specific cure.
Unfortunately, we don't have ironclad or tried and true evidence for any one method.
But before we debunk the myths, what exactly happens to our body during a hangover?
There are a few things that we can draw from the science. The first is that alcohol breaks down in our bodies to a bunch of different component parts.
The process of metabolizing that alcohol can dehydrate the body, creating those nasty symptoms. It can even mess with sleep.
It can affect hormones that actually regulate our biological clocks. Alcohol actually can interfere with our brain activity when we sleep, so sleep is more fragmented.
Leading to that potential grogginess the next day. So what can alleviate symptoms and what doesn't work at all? First, Dr. Liao says forget about that beer or Bloody Mary the next morning, commonly known as
taking a hair from the dog that bit you. It's a very interesting kind of term. The idea is, well, if hangover symptoms come when the alcohol levels are low, let me take another sip of alcohol, to kind of curb that. I think that perpetuates the cycle. It can actually prolong the symptoms.
Liao says during a hangover, the body is trying to flush alcohol out of our system, and adding more to it, even in small levels, will only prolong the process. Hydration is also key here, since alcohol is a diuretic, meaning it causes us to lose water.
What can happen is dehydration can contribute to some of those feelings that we have the morning after or the day after.
So that Gatorade or Pedialyte drink might help.
Electrolytes can be lost when people drink alcohol. So there is an idea that soups, bouillons, Gatorade, electrolyte-rich drinks can help. Again, no ironclad evidence there, but I think it makes good sense.
Which leads us to prevention. Liao says avoid dehydration and make sure to drink water in addition to alcoholic drinks. And don't drink alcohol on an empty stomach. Eating before and during drinking prevents blood sugar levels from dipping while the body breaks down that alcohol. And it does not have to be greasy food.
And there's not the food or this other food, but things like carbohydrates, toast, juice, things that have sugar in it can really help as well.
But ultimately, it falls to this.
If you want to prevent a hangover, there's only one tried and true method, which is abstinence from alcohol.
And a warning, Dr. Liao says don't take Tylenol or other forms of acetaminophen for a hangover remedy because that medication is broken down in the liver. Alcohol is also metabolized in the liver, so combining the two could overwork the liver and potentially cause liver failure. A newly released paper published in the Journal of the American Medical Association, or JAMA, says moderate drinking isn't as beneficial as some suspected. It found the risk of dying prematurely goes up for women who have around 2 drinks a day and for men who have up to 3 drinks a day.
It was one of the largest studies I've seen, but there are others that have found the same thing.
Dr. Joseph Merrill is a professor of medicine at the University of Washington and specializes in addiction medicine, including alcohol use. From what he's seen as a physician, he agrees with the findings from the new report.
That this perceived or at first glance what looks like a health benefit of alcohol isn't really true.
U.S. guidelines by the National Institutes of Health consider moderate drinking as 2 drinks a day for men and 1 drink a day for women. Studies have touted certain alcoholic drinks like red wine as beneficial, pointing to the antioxidant effects of resveratrol, a compound found in grapes. But much of the past research was flawed, according to the new analysis.
What this study added was a more careful look at the data, and especially trying to avoid the bias that was introduced in studies that look at folks who drink moderately compared to people who don't drink at all.
That bias falls within who light drinkers were compared to in prior observational studies. The new report revealed they were sometimes compared to people who don't drink at all. However, those people who quit drinking may have done so because of alcohol-related health problems. And moderate drinkers tend to have healthier lifestyles.
Is it bad to have a drink a day? Is that clearly associated with a mortality worsening? No, that's not clear either. But it is clear that we shouldn't be adding alcohol with the thought that drinking a drink a day is going to make you live longer.
Dr. Merrill points out that alcohol is a toxin. No matter how much you take in, when the body metabolizes it, those toxins can have adverse effects on organs such as the liver, but it can also do cell damage, which in some cases can lead to certain cancers. The biggest takeaway?
Drinking is not a healthful activity, that it won't increase our lifespan even at low levels of drinking.
The doctors we talked to for this story say if you're having symptoms, get tested. If you're not having symptoms, get tested. And for the women we talked to for this story, trusting their gut saved their lives. Sherry Enholm was 47 years old when she started noticing symptoms.
I was constipated. I was bloated. I was nauseous most of the time.
Cancer was the last thing on her mind.
Old men got colon cancer. It wasn't something that was even on my radar. I had no clue.
When she turned 50, her symptoms persisting, her doctor told her to take an at-home stool test, which showed signs of blood, a red flag. Her follow-up colonoscopy then revealed an egg-sized tumor in her colon.
The gastroenterologist, he looked at me and he said, "You have colon cancer." I said, "No, I don't." He said, "Yes, you do." And I just started to cry because how do I have colon cancer?
Sherry was in her 40s when doctors said she had developed colon cancer. In fact, cases diagnosed among people aged 45 to 49 are going up.
It's not entirely clear yet why that's happening. There's active research being done in that area.
Dr. John Dunn, medical director of knowledge and implementation at Kaiser Permanente, says it's why screenings matter more than ever. The CDC recommends people with average risk of colorectal cancer and no family history of it begin screening at age 45. A colonoscopy every 10 years for this age group is the standard method. Those with average risk may also take an annual at-home test, such as the fecal immunochemical test, also known as FIT, which looks for microscopic blood in your stool. Dr. Dunn says one or the other isn't better or more accurate. The point is, just do it.
The guiding principle behind recommendations for colorectal cancer screening is that the most effective test is the one that's going to get done.
That was the message at a colorectal cancer awareness event in Kent this month. Dr. Rachel Isaka of Fred Hutch Cancer Center points out certain groups may be more at risk.
In the United States, we know that Black people and Native American, Alaska Native individuals are more likely to die from this disease than any other groups.
This largely due to
lack of awareness and also lack of testing.
Frankie White wants to increase awareness by sharing her experience with rectal cancer when she was only in her mid-30s.
It was sort of shocking. Usually people at that age aren't diagnosed with cancer, rectal cancer, but I was, and because I was so young, the cancer was more aggressive.
Frankie underwent surgery and chemotherapy and survived. Like Frankie, Sherry considers herself among the lucky ones and says you shouldn't feel timid about sharing what's going on in your gut.
You know, don't be embarrassed to death. It's poop. It's not. You've got to be able to talk about it. You've got to be able to advocate for yourself. If something's not right in your body and you know it, find a way to communicate that.
Preventative screening measures for colon cancer are covered by the Affordable Care Act. A FIT test is typically about $20 or is covered by insurance.
Those levels over the course of somebody's lifetime is one of the single best predictors of a risk of heart attack or stroke.
Dr. Amy Cheney is a cardiologist at Overlake Medical Center. She says when you get your cholesterol tested from a blood draw, doctors will focus on two separate levels.
Really want a high level of HDL and as low as possible of LDL.
HDL is short for high-density lipoprotein. That is considered good cholesterol. LDL is low density, which is known as the bad cholesterol.
Circulating LDL is really the culprit.
Here's why. Over time, high levels of LDL cholesterol can build up as plaque in blood vessels.
If it adheres to the coronary arteries, which are the arteries that supply the heart, then that can lead to a heart attack.
And any blockage in the vessels in the brain can lead to a stroke.
So what we're trying to do is to reduce that as low as possible, because if there's not the building blocks to create this plaque, if there's fewer and fewer of those building blocks, then people are less and less likely to have adverse events, which we think of as heart attack and stroke.
Ideal levels of LDL are below 100 milligrams per deciliter of blood. Healthy levels of HDL should be above 60 milligrams. While older people have a greater risk of concerning cholesterol levels, young people should pay attention too.
That includes whether you're an adult, a young adult, a child. Believe it or not, 5 to 7% of children have elevated cholesterol.
High cholesterol can also be hereditary.
If you have a first-degree relative, mom, dad, brother, sister, who has had a heart attack at a young age, we know there's something going on in the genetic material that's predisposing people in that family to have those events.
It's why doctors recommend getting cholesterol tested regularly. Low-risk adults every 4 to 6 years, but if you're at higher risk, more often than that. You can lower bad LDL cholesterol levels by cutting saturated fat from your diet, things like red meat, fried foods, and butter, and exercising regularly. Eating more foods rich in HDL cholesterol, like avocados, nuts, and fish, may also help. Part of why HDL is good is because it takes excess cholesterol in the blood back to the liver, where it is metabolized and removed from the body.
Get your cholesterol checked if maybe it's completely normal and maybe it's something that just needs to be monitored. But on the off chance that it isn't, it's something you want to know about sooner rather than later.
Thanks for joining us today. To check out my most recent Healthlink report and get the latest health news, visit king5.com/healthlink.